So on multiple teeth, also the mini implant excels in that area. The smaller diameter implant, we tend to mimic nature, where on a molar, you have 2-3 roots. We'll go in and place 2 small diameter implants, very similar to what Mother Nature gave you. And then on your anterior teeth that are single rooted teeth, we can place 1 implant, and then we typically splint them together. For example, if you had a bicuspid or 2 bicuspids missing with a molar, which is something we commonly see and commonly do, we'll place 3 to 4 of the small diameter mini implants and let them integrate for 4 to 8 weeks, depending whether it was post-extraction or just replacing a tooth that's been extracted for a significant amount of time. And then we splint them together. After 4 weeks, we uncover and remove the splint, test the implants, make sure they're solid, and then we can impress that with a digital impression, send it to the lab. Within 10 days, we get the crown or fixed bridge back, and we glue it on permanently, and it becomes yours.